I trained at University of Missouri, Kansas City. I'm originally from Richmond, Missouri, which is a little town up around Kansas City. I went for my general surgery training at Tulane in New Orleans, and then got married there to a nurse. We moved from there to Tennessee and worked in West Tennessee for about 18 and a half, 19 years. From there, we decided that I needed to go get more training in cosmetics, so I did a year fellowship in Tulsa with some really good guys over there. Passed my boards, and how I got to Northwest Arkansas was with the roller weight loss group. They do a massive amount of work helping people lose weight. And of course, after you lose weight, and so my job working with them is to help their patients realize their end goal of losing the skin and the excess weight. I like my outside interests are, I like jacking around on my what little acreage I have and cutting down trees, and I like to play golf, and I'm a musician. I'm a drummer in a band in Tulsa right now, and I have a lot of fun with that. Well, my training is based in general surgery. I did my initial residency was after medical school. You have to go do a residency to be trained, and my original training was in general surgery and vascular surgery, and so I did a residency in those things. When I decided I wanted to start doing more cosmetic-oriented things, there are basically two options. One option is to do what's called plastic surgery, which is you do a fellowship or a residency in plastic surgery, and plastic surgeons learn a lot of things. They learn how to do hand surgery, how to do craniofacial surgery, how to take care of burns, how to do flaps to close wounds, in addition to aesthetic surgery. What I didn't want to do those things. I just wanted to do the aesthetic part of it, and so my choice was to go straight into cosmetic surgery. So my board certification is not only in general surgery, but is in general cosmetic surgery and also in facial cosmetic surgery. And what I did was I did a year fellowship where I did 1,300 plus cases in a year in a fellowship environment, which means that I'm training with other doctors who already have what I'm trying to gain. And so I don't do a lot of the things that plastic surgeons do. I just do the aesthetics part of it. Well, I decided to become a doctor because of one of my friend's fathers, who was a physician, and I just thought it was kind of cool. And I kind of followed him around when I was pretty little, probably 10 or 12 or 13, something like that. And he was a real good guy, good doctor, and I just thought it was a neat thing to do. And from that point on, that's just what I was going to do. I practiced vascular surgery and general surgery for a long time, for 18 plus years, and still do some. And the patients that come in then are generally sick. They're looking for any port in a storm, really, and it's great to help those people. And I went back and did a fellowship in cosmetic surgery because I had a growing interest in that field, and now when patients come now, they're generally pretty happy. They just have areas that they're unhappy with, and especially with women, they look great in college. They get married, still look good. They have children, and after children, still look good. But kids childbirth does a lot of damage, and so the nice thing about taking care of those people is they're happy when they come in, and they're really happy when they leave, because you've kind of given them back the body that they had when they were in college, and that's pretty cool. And daddies are happy too.